Hi, my name is Chelsea Bennett. I'm a family nurse practitioner student at Arkansas State University in Jonesboro, Arkansas. The title of my presentation is A Local Clinic Rate of Type 2 Diabetics Receiving Annual Comprehensive Foot Exams. I'd like to acknowledge Dr. Christopher Jordan, my advisor, and Dr. Lauren Cood, my clinical instructor. So this is my poster for my presentation. I have the title up at the top, and then I'm going to go through each part of it piece by piece and break it up. According to the American Diabetes Association guidelines, all individuals with diabetes should receive an annual foot exam to identify high-risk foot conditions. Comprehensive foot care that includes screening exams and risk assessments for patients with diabetes reduces the rate of ulceration nearly 75% and amputation up to 85%. And then diabetic foot ulcers are the leading cause of non-traumatic lower extremity amputation in the U.S., and costs related to the treatment of diabetic foot ulcers are well over $1 million annually. Despite all these staggering statistics, many primary care providers fail to adhere to these guidelines. Data suggests that the diabetic foot is only adequately evaluated only 12 to 20% of the time. So this is just something that I included in on my poster. It has the criteria that the provider would look at on a diabetic foot, and then the risk classification that patient would fall under with the criteria, and then just patient education, such as the patient should always wear shoes and shouldn't be barefoot, and then they should also evaluate their own feet daily and call their provider with any abnormalities. There's also a few diagrams on here. The purpose of this study was to compare the percentage of adult patients 45 to 75 years of age with type 2 diabetes mellitus that are receiving their annual comprehensive foot exam and a risk assessments in adherence with the American Diabetes Association guidelines in a rural clinic in Northeast Arkansas compared with the national average. First, an IRB was obtained through Arkansas State University. The study was conducted using a retrospective chart review of 50 charts through electronic medical records in a primary care clinic from November 1st, 2018 to November 1st, 2019. A data collection tool was used to gather and transcribe information. The data that was collected included age, gender, ICD-10 code, and if the patient had or had not received a diabetic foot exam. The patient population included both men and women, ages 45 to 75, with a diagnosis of type 2 diabetes, and then they had to be a patient in the rural clinic in Northeast Arkansas from November 2018 to November 2019. This study found that the percentage of foot exams completed on type 2 diabetics from November 2018 to 2019 in the clinic in Northeast Arkansas was 48% compared to the national average of 71.6%. On my poster, I've included two different graphs that show the findings in two different ways, both a bar graph located above the findings section and a pie chart located underneath the findings section. First, I've included the bar graph. The first line is the 48% that the clinic was at for completed foot exams compared to the national average, which is the next line of 71.6%. First, I've included the bar graph. The first line is the 48% that the clinic was at for completed foot exams compared to the national average, which is the next line of 71.6%. This is the pie chart that I was talking about. The blue is the clinic's average of foot exams completed, and then the red is the national average. You can see that the average is significantly more than the clinics. This study found that the foot exams were performed significantly less often for diabetics given at the local clinic in Northeast Arkansas when compared to the national average. An action plan to fix this could be to encourage the providers to perform the foot exams by showing them this study, or to just something simple like having the person, nurse, or whoever is taking the patient back, have them take off their shoes and their socks if they're diabetic. That way the provider knows that that needs to be done. So this is my reference page for my presentation. Thank you for listening.